Hello everyone, I am Dr. Anupama Gangwal, Senior Consultant Obstetrician and Gynecologist at Cocoon Hospital, and I have special interest in high-risk pregnancy, ultrasound and aesthetic gynecology. So now bleeding in early pregnancy, actually sometimes it may be just normal because it may be just a sign of an implantation bleeding. That is when the fetus sticks inside the uterus, you may have a little drops of blood, and sometimes it is normal, yes. When would a person or a pregnant mother be worried if she is bleeding? If there is excessive bleeding, if it is very bright red in color, if there are clots, if she has cramps, or she has episodes of dizziness. Whenever you feel like that, you must immediately seek medical attention. So bleeding in early pregnancy, like I said, could be a sign of implantation bleeding, or sometimes bleeding in early pregnancy happens if there is early pregnancy failure. That is, you are going into a potential miscarriage, or there may be an ectopic pregnancy. The pregnancy is not inside the uterus, it is somewhere else where it should not be. Or it could be an abnormal pregnancy, and that, or sometimes the mouth of the uterus becomes so soft in pregnancy that it may cause a few drops of bleeding. So not necessarily, like I told you, not always bleeding in pregnancy means that you are not going to sail through your pregnancy. Women who have had a few episodes of bleeding in pregnancy have known to go to term, carry healthy babies. So it does not always mean that you will land up in a failure. All you need to do is meet your gynecologist, go for your scan, and that they will find the way out. If at all a pregnant woman, that is a mother, she feels that she has bleeding from the vagina, the first thing I would tell you is that it is definitely not always alarming, but it is not to be ignored. And at that time, I would advise my patients to seek the doctor's immediate help. Either reach the hospital or consult your doctor, go for a definitive treatment, follow your doctor's advice, and that is the best way to sort this problem out. To reduce the risk of bleeding in early pregnancy, honestly, there is no specific condition. All I want to say to women is, if you maintain a healthy lifestyle, maintain a healthy diet, you're not overexerting yourself, you're not overstressing yourself, you have been going for your regular prenatal medication, prenatal checkups, then definitely your risk for a bleed in pregnancy decreases. Some conditions are not in your hand, like a low-lying placenta, but definitely most of them can be sorted. So the message that I want to give to all of you, to expecting mothers or those who are planning pregnancy, is if at all there is a bleed in pregnancy, whether in the first trimester or up in the last trimester, the thing is that don't panic, but don't ignore. Seek your doctor's help right away.